supposed to be a connection. So you find that these connections that have been made between two organs or between two tissues, they will lead to the mixing up of things that are not supposed to mix up. Okay. You find that in a particular organ there's something else, and then in another organ there's something else. They mix up. So the stigma that is coming as a result of these same fistulas is for the fact that you will find that these things that are mixing, they're leading to complications. And these complications are the ones now that people from the outside circles will be able to see from a particular individual who is suffering from these fistulas.
Okay, and that's what they stigmatize.
Yes.
Okay, so what, apart from the stigma, what other impacts are mentored on these individuals who have this particular fistula?
So when we talk about the impacts, so I can classify the impacts to be maybe social impacts, psychological impacts, as well as the medical impacts. Okay. So remember, this is a medical or surgical emergency, which needs some sort of an attention by a medical practitioner. So you find that when it comes to the medical impacts, you find that these people are prone to having infections because different things that are not supposed to mix are mixing. And when they mix, they'll cause infections. They'll be more like a playground for germs, bacteria, and so on and so forth. Okay. So they'll suffer rather in that particular aspect, the medical aspect. Then when it comes to the social aspect, these people who are suffering from the fistulas, they'll lose their self-esteem. Their confidence will be reduced because they might be having some sort of an odor, or they'll be smelling, for lack of a better term. And then that will be affecting their mental aspect. Okay. To some extent, they will be thinking that maybe I'm not supposed to be in this particular area because of my condition. So that's on the social aspect. Then when it comes to the psychological impact, we are focusing basically on the depression that will arise due to this particular suffering that they are going through. Because remember now, they are trying to stay away from people. And then eventually they'll just be lonely. They'll be alone. And then in the long run, they will fall into depression.
Okay, so does it cause discomfort and infections?
Yes, it causes discomfort as well as infections. So like I said, one of the complications are infections. So bacteria are mixing. Let's say, for instance, there's a fistula that we call a tracheoesophageal fistula. So from the word tracheoesophageal fistula, meaning there are two organs or tubes that are having a communication. So from the word tracheoesophageal, meaning the trachea is mixing with the esophagus. Okay. So in the esophagus, food passes through that tube, and then the trachea, that's the windpipe. We use it for breathing. So imagine if you take, let's say for instance, you take some tea in the morning, and then instead of it going through the esophagus eventually into the bowels, you find that it will go into the windpipe. And when it goes into the windpipe, that food is not supposed to go into the windpipe. It is supposed to go in the esophagus. So when it goes into the windpipe, it will cause an infection to the lungs. Because remember, the trachea is now going to the lungs. So it's more like a connection. You have your two lungs, then the trachea, which is the windpipe. But there goes food in there. So it will have some sort of reactions with the cells which are found in the lungs, causing an inflammation, and eventually you have an infection.
So does each type have a distinct symptom to it, or symptoms?
Yes. So maybe before I go to the symptoms, I would like to maybe air out the types. Okay. So that, because most of these symptoms are tailored to the type in particular. So when you're talking about a fistula, there are different types. So I can try maybe to subdivide them. Some types are known as congenital fistulas, then others are just acquired. So what we mean by congenital, we are simply focusing on those fistulas that a baby is born with. Okay. So they haven't yet been born, but maybe they are still in the mother's womb, but they already have that particular fistula. And an example I can give is the same tracheoesophageal fistula I was talking about. Then there are other acquired fistulas that will come about. Maybe somebody is just even older. Let's say maybe they are 30 years old, and then they acquire a fistula. So when it comes to these acquired fistulas, they are again categorized depending on how they are coming about. So we have what we are calling traumatic fistulas, which can be acquired. When we talk of our ladies, probably when they are pregnant, they will go through a phase which is an obstetric phase during their child birth process. So you find that sometimes their labor might be delayed. And as the labor is being delayed, there will be some sort of tension that will arise, maybe it will be associated with the medical practitioners. It will be associated with the medical practitioners as they are trying to deliver this baby. And then in the event they are trying to deliver the baby, you will find that they'll cause some injury.
Okay.
So as they cause an injury, they might cause an injury to the birth canal. And then when they cause an injury to that birth canal, it will communicate, let's say, with the bladder. And then you will find that there will be a fistula, which we are calling a vesico-vaginal fistula.
Okay.
Because it will be a communication between the birth canal, which is the vagina, and then the bladder. Meaning the bladder which stores urine, that urine which is supposed to store will be going into the vagina.
Okay.
And then there will be that communication, meaning it will be leaking to the vagina. And then the symptom that you obviously now see will be leaking of urine or incontinence of urine, so to say. So that is just tailored to that particular type of fistula. Then for fistulas like the congenital one I mentioned, the tracheoesophageal fistula, you find that someone will be coughing because the food which is supposed to be in the esophagus has now gone into the windpipe. So what will happen? There will be that reflux that will be happening, a sensation, because something is in a place where it's not supposed to be. So somebody will be coughing, the baby will be coughing due to that particular fistula. So the symptoms are just tailored to a particular fistula.
Okay, so can you talk a bit more about the ones that come when a child is just born? Like, is there any way to prevent it when it's specifically tailored to a newborn child?
Okay, so in the case of a tracheoesophageal fistula, because it's the most common congenital type of fistula, you find that the approach that we give it, immediately the baby is born, we suggest to say that baby goes into surgery.
Okay.
Because remember, most of these is just communication. So you have two tubes, and there's a communication between those two tubes. So surgically, you can sort out that issue by just cutting and resecting. So you find that this particular tube, which is the trachea, or esophagus, is joining into the trachea. You can just cut and join it to the way or to the other tube which is in alignment with its use.
Okay, so is it easily detectable?
Yes, it's easily detectable because you just find the baby is born and they are coughing continuously.
Okay.
Then you will now start suspecting to say, okay, this baby might have something to do with the respiratory system as well as the gastrointestinal system. Then you carry out some tests to confirm your diagnosis. Then eventually, through running of some scans, you find that it will show you to say there's a communication at this particular point. Then you can work on it.
Okay. The phone lines are open in case you have questions, contributions, suggestions. Call through the lines that are scrolling on the screen. You can send us an SMS and we'll be able to read the SMS and find some answers from the doctor. We go for a short break or we'll be right back.
Christ Life is more than a school. It's a nurturing community. Our qualified teachers use innovative methods that keep the minds and hearts of our students engaged. Our cafeteria isn't just a place to eat. It's a hub of nourishment and community. Our sports activities are always filled with fun and creativity that promote teamwork and confidence in every child. With access to the latest educational software, learners are prepared for the digital age with confidence and creativity, empowering students with skills in and out of the classroom. Swimming is a life skill that is cardinal for survival. Our ballet programs teaches more than just dance. It installs grace, discipline, and expression. The heart of knowledge builds in our school library with a wide collection of fiction, non-fiction, reference material, and digital resources. Our school offers exciting and safe playground facilities for both ECE and primary students. Safety is our top priority, and our drivers are carefully selected for their professionalism and commitment to the well-being of our students. At Christ Life School, we believe education is not just about passing exams, it's about preparation. So, if you are looking for a school that feels like home, where your child will be known, loved, and challenged to reach their highest potential, then Christ Life School is the place.
Choirs of Zambia. The stage is calling. Get ready to sing, praise, and compete for the ultimate crown and win a staggering 100,000 kwacha cash prize.
Here is how to enter.
Record a 2-minute video of your choir singing. Let your choir leader introduce their group. Send your clip via WhatsApp on 0968 261196 or email cbc.lighttv@gmail.com or bring it to CBC TV, plot number N4, Zambezi Road, Minwood, Ibex. This is your chance to win on Zambia's biggest Christian music stage. Don't wait. Entries close soon.
Battle of the Choirs.
Battle of the Choirs. See you there.
Terms and conditions apply.
Welcome back, or we continue with the topic of fistulas. Like I said, the phone lines are open. You can call through with questions, suggestions, and contributions. And you can send through SMSs on the very lines. Doctor, talking about the causes, you mentioned that some of the causes arise when a child is just born and some when a mother is giving birth. How about in men? What are some of the causes?
All right. So when we focus on men, you find that for men, usually, there are those men who come in with fistulas, which are as a result of a cancer.
Okay.
Let's say maybe they have a tumor. So the way these tumors work, you find that they'll be corroding. Let's say you have a tumor in the colon, for instance, which are the large intestines. You have a tumor there. And that tumor will keep on growing. If maybe you are just taking it lightly to say, maybe I'm just having a stomach pain or something, you don't pay particular attention to it. It will keep on growing, it will be corroding on the skin, and then eventually it will pop out.
Yes.
Meaning it will cause some sort of a connection or a communication with another organ which is nearby that particular area.
Okay.
So you find that tumors also give rise to fistulas.
Okay.
So if someone has got a tumor of the colon or of any of the bowels, it will corrode and have a communication with another organ. That's particularly in men. And then in other scenarios, you find that a traumatic event might happen. Maybe somebody is involved in a road traffic accident.
Okay.
And then organs inside, they are more like fragile, so to say. So you find that there will be a rupture and then a communication between different organs which will give rise to a fistula. Then not only that, you find that infections also give rise to what we are calling abscesses.
Okay.
In local language, we usually say chikute.
Okay.
So you find that an abscess will keep on growing, and eventually, as it more like breaks, it will release those amafina which it has, and then eventually it will go into communication with another organ leading to the same fistulas.
Okay. So in these different cases, what are some of the symptoms that people can detect early to see that, oh, actually this is a fistula growing, or that's in between these tubes?
All right. So some of the early symptoms that you can detect. Remember, these fistulas are not, of course, maybe they are exceptions.
Yes.
But most of these fistulas are coming about due to a primary cause. So there's already maybe an infection that is happening.
Okay.
There's already a cancer or a tumor that somebody is having, and then it will give rise to a fistula. So the emphasis here should be, once you just have some sort of, you are not in your normal state, you're having certain symptoms that you know to say, okay, I'm not like this every day. You have to seek medical attention, because it is by treating those primary causes that you also at least play a certain percentage in the prevention as well as treatment of these fistulas.
Okay. So apart from surgeries, what are some of the other treatments and remedies?
So there are other treatments and remedies. Sometimes you find that maybe somebody is having a fistula between the bladder as well as the vaginal canal, meaning there will be leakage of urine. So sometimes we give them a catheter to assist them to prevent or reduce that leakage that is happening. So apart from these surgeries, like the same catheters, there's also medication. But usually when we're talking of medication, medication is just simply tailored to treating the infections that are arising due to these same fistulas. Remember, different fluids are mixing, leading to a bacterial playground. So sometimes we might just prescribe antibiotics, broad spectrum antibiotics. We put them on antibiotics so that those infections that are arising can be treated, in as much as we are thinking about the surgical route, which provides some sort of 100% cure to these fistulas.
Okay, that's very reassuring. So what advice would you give to individuals affected by fistulas?
So the first advice I can give them is, first of all, to accept the condition that they are in. It's only by acceptance that you'll be able to agree to the treatment measures. Most of the people, they don't like accepting these. As a result, they'll keep the condition to themselves, and it will keep on increasing, deteriorating their health, so to say. So once somebody accepts, then they'll be able to open up to say, okay, my friend, I have this condition. How can I go about it? But the most advice I can give them is to seek medical attention whenever they have symptoms or signs concerning this particular condition. And amongst those symptoms, you find that since most of these fistulas, you find they affect the bowels. And the bowels are the ones that are in charge of the absorption of food when you eat. So if someone is having a fistula, let's say a vesicle colon fistula or colon vesicle, which affects the colon as well as the bladder, you find that they'll be losing fluids and they'll go into dehydration. The foods that they are eating won't undergo complete absorption because of the disturbance. Hence, you find that these people will start losing weight. They'll be having dehydration, and then they will have superimposed infections which are coming as a result because you are eating food and that food is not doing its intended job of providing some sort of health or boosting your immune system. So you find that these are some of the things that will affect them. So they just need to seek medical attention and ensure that a medical practitioner from a hospital attends to them and gives them further guidance, whether it will be the surgical route or maybe conservative treatment, which is the medical route as well.
Okay. So has there been anything else maybe that you'd like to contribute more about all the questions that have been asked that maybe we did not touch that is very important to the topic of fistulas?
Okay, maybe I would also like to air out fistulas in terms of the categories. So sometimes you might find people discussing or talking about internal and external fistulas.
Okay.
So there are those fistulas that you just find they're just internally. So they are causing harm internally. There's a communication between organs internally. And then there are those fistulas, particularly fistulas that are coming about due to infections. You'll find that an abscess protrudes and moves out the skin.
Okay.
So you have maybe someone is having an abscess inside the stomach, and then that abscess will now protrude through the skin and cause that fistula, which is communicating with the external environment, which we are now calling an external fistula.
Okay.
So they can be internal fistulas as well as external fistulas. That's also one of the classifications that I think I should have aired out when we started at the beginning. Yeah.
So how do external fistulas present themselves?
So external fistulas will present as a wound.
Okay.
So you find someone is having a wound on the belly, and then when you focus more, you try to run scans, you try to run tests, you find that maybe this particular fistula, and one type of a fistula is the anal fistula.
Okay.
You find that the anal fistula is more like an external fistula, because the anal canal, where food is supposed to be digested, by digestion we mean getting rid of the undigested foods. So you find that the anal canal, that's where food is supposed to be digested, but it will have a communication with the skin. So there's the anal canal and then the surrounding skin.
Okay.
So instead of it just having an outlet from the anus itself, it goes through a skin opening. And then that skin opening, you find that now they'll be having leakage of feces. Okay. Meaning some of the signs that they will see is that they will have, of course, an odor. Obviously, an odor which is more than the normal odor that is expected. And then they'll also be having some sort of things that will be coming out from an area where things are not supposed to come out. So those are some of the signs that you see when it comes to external fistulas, because you'll be able to see with your naked eyes the things that are coming out at a particular point where things are not supposed to come out.
Okay, so when you talk of a wound, let's say for example on the belly, could it even be as small as a pimple, or it's something that's maybe very big like a cut, or like each putte, the way you put it?
Yeah, so depending on the severity of the fistula, they might vary in size, but the thing is, depending that particular size that you see, it will only be allowing, or you'll be able to see it, because remember the skin stretches. So sometimes, let's say maybe if it's a fistula that is on the anal region, you'll be seeing certain things on that particular point. You might not really ascertain the size of a particular wound, but you see there's an opening, just the same way each putte is. You find that when you try to remove those things from that particular abscess, you remember take a small point to obviously say, okay, there's something here. So you'll be able to notice, but you really can't quantify, or you really can't predict the actual size of that particular fistula, but it will be an opening because there's already a communication between two organs, vessels, or tissues.
Okay. Yes. Okay, thank you so much, Dr. Chilamuka, for shedding light on this important topic. Remember, awareness and timely intervention can make a significant difference. This has been Community Health Talk. Join us next time, and come through with your text messages, your contributions, so that you can learn more from the Community Health Talk. But for now, it's goodbye.
Thank you.
For the most anticipated talk show of the year.
Let's talk about it with Pastor Pauline. So we have been discussing foundations upon which most of the relationships are built.